Isle of the Caribbean, the independence season has officially been launched and open. And I know many of you have already booked your tickets. Those who are listening from overseas know that you have United being part of the fleet. And so we are excited that you will be here in Dominica to celebrate our independence with us this year. My co-host Trudy, good morning to you, my dear.
Good morning to you, Carlton. Of course, good morning to the listeners of Q95 FM Radio or Health Vibes crew. Good morning to you. It is always a pleasure to be here on the airwaves on a Wednesday morning, Carlton, with you. And of course, representing the Jollies brand and the need to discuss and promote health and wellness. So always a pleasure. I like, Carlton, that you said it's a good day to have a good
It
day.
is, it is, it is.
Definitely staying positive helps. And just yesterday I said, you know what, Trudy, always just focus on the positive. So this morning I just want to shout out people who, may be dealing with a lot, maybe stressed,
Mhm.
and always kind of reinforce the need to seek out what is positive and focus on that, and highlight the positive aspects of whatever it is you may have going on in life. It's a good day to have a good day.
Mhm. And in spite of what it is, that everything happens for a reason and God does all things well.
Yes, yes,
But
yes.
so wherever you are, we're saying good morning to you. Those of you who may be, still in a little chance to listen to us, maybe whilst you're in the office, you know, still follow the protocol. Yeah, we don't want you to lose your job, but we welcome you on board. Our retired people who always listened, good morning to you. As Trudy have always coined it, you get all the good vibes on Health
Oh,
Vibes,
yes.
the credible, important vibes on Health Vibes. And this morning we do have a very, very, very important topic that we're going to be discussing. It is one that is very passionate to me. I think over the past couple of months, I have had a few public health lectures, and I have focused on that particular topic. And I felt, now is a good time to share the contents of that topic to the nation, the world by extension. And this morning, we are going to be focusing on polypharmacy. I know you might be wondering, what is that?
What is that? Yes.
Polypharmacy. What is that all about? But it's a very, very critical in the field of medicine and pharmacy. And we will be discussing that this morning to you. Let me again, uh, I don't want to use the word big up, but maybe I should say big up. Our managing director, Orin Jolly, our human resource department, our GNC department, our marketing department for an incredible health and wellness month
Month,
that was
September.
held in September
Hmm.
at Jolly's Pharmacy. I think every staff enjoyed that to the max. It was a really, really, really exciting calendar of events. We had the football finals on
Hmm.
Saturday evening
Hmm.
at the Newton Savannah. I think the storeroom department won,
Okay.
and I think that team won. I think over $1,000 for winning the football
Nice.
tournament.
Nice.
We had our talent, as we spoke about last
Hmm.
week.
Talent
We
show.
had the Watu,
Yeah,
which was
Wato,
I
the,
was
the
told it
cooking at
was
Rosalie.
awesome. I
Hmm.
missed it because I was really exhausted on the weekend, and I
Oh,
really took the opportunity to rest. I really had an intense month in September, having to do so many public health lectures and so forth. But from all reports, the staff really, really enjoyed it,
hmm,
and the weather was favorable too.
hmm.
And today we are crunching down the numbers for Biggest
Biggest
Loser
loser. So today will the
competition.
winner be
Yes, we will announce the winner tomorrow.
Tomorrow.
Yes,
Okay.
yes. I
Okay.
think that person is winning $1,000.
Ah.
Yeah, so we've given a lot of money was spent in the month of September to celebrate our staff health and wellness activities, and we really want to thank the team who really made this possible,
Mm-hmm.
and more importantly, our staff for really embracing the opportunities that were given and really running with it and participating. And every activity that was held was well supported by our staff, and we
Yes.
really want to
Yes.
thank them.
Yes, Carlton, I did notice that you all had a good time, and all while, recognizing the contributions of the staff, but also health and wellness themes as well, the
Yes.
football, so it was a whole set of activities that just really came together. So I think people were grudging the Jollies team
Yes.
for for all of these great activities in the month of September, and of course culminating, as you said, with the Biggest
Yes.
Loser
Yes.
announcement. So everybody got a chance to win something
True.
throughout the activities. So definitely commendable.
True. And I
Hmm.
must say too that our company really truly celebrated the World Pharmacist Day with us, like
Hmm.
they have always done. This year, I felt they went one step higher.
Above, yeah, higher.
Yes, the bar was higher. Every pharmacist was personally celebrated, not just for social media, but personally in terms of gifts.
Okay.
Every one of us received some really good gifts, compliments the company, and we truly want to say thank you to the Human Resource Department for recognizing all of our pharmacists at Jolly's Pharmacy for the hard work that we do
Hmm.
every day when we serve our people. So
Hmm.
again, more kudos to the
Yes.
best company to work for on island, Jolly's Pharmacy. What we're going to do now, we're going to take a short break. It is now 10:30. And so we're going to take a break and then we'll be right back into our discussion.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop with your daughter or with your son. Shop. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop. Bring papa and mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Who say?
Introducing Jolly's Pharmacy, brand new website www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Christian. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you, of course, here on Health Vibes this morning. Yesterday, Tuesday, October 1st, was the International Day of Older Persons. And the month of September, of course, locally was celebrated as the month of the elderly. And one of the issues, or one of the things as it relates to health, that many older persons have to face is dealing with taking several medications. Our topic this morning, Carlton mentioned, is polypharmacy, and people may be wondering, what is polypharmacy? The term sounds big, but simply put, poly means many, pharmacy, of course, we're speaking about medication. So having to take or the use of multiple medications at the same time. Carlton, I know, and maybe our listeners can also recognize people that they may know that have to take multiple medications at the same time, or they themselves, those of the listeners who maybe have multiple medications to take at the same time. Different conditions, different medications, different regimens required for the different medications, different possible risk factors associated with the use of the different medications. And I do know a lot of people think that this is very tiresome, very stressful to have to manage taking multiple medications. I do know too that it can be overwhelming for some people just to get prescriptions and say, boy, I have to take this, I have to take that. I know, Carlton, as well, some people, because of that, their compliance to their medication regimens may not be ideal, because it might just be, overwhelming for them to handle taking different medications concurrently. So this morning we want to kind of delve into that a bit. Of course, Carlton, as the pharmacist in the house, you are well poised to guide the discussion here on having to deal with taking concurrently multiple medications, polypharmacy, and some of the factors that need to be considered with that. I noticed, Carlton, that a lot of our listeners are joining in on our Facebook page, the Q95 FM's Facebook page, and of course the YouTube channel as well. I just want to recognize them. If you know someone, or you yourself take multiple medications, this is definitely a conversation that you want to tune into. So if you're listening to us on radio and you want to even jump on the Facebook page or on the YouTube channel of Q95 FM to really tune into this discussion, feel free to do so. There's going to be a lot that will be discussed and a lot of educational information as it relates to taking multiple medications and managing that. So, Carlton, I want to start off by asking you, first of all, what do you often see as a pharmacist in terms of medications, multiple medications? What sort of conditions typically occur together that people would have to take different medications to manage?
And that's a very good question that you've raised. As you did mention and characterized polypharmacy as a term that is used in the area of medicine that simply means a patient that would be using multiple medications. And when we talk about multiple medications, we're talking about more than 5 different drugs for different ailments. Now, if we look at the demographics, would recognize that who would warrant being on multiple medications? Generally, the elderly, people who may have immunocompromised. So let's say you have an immune system disease, somebody that may have been born with a congenital condition. You may have
Uh-huh.
been born with some type of congenital condition, let's say heart disease as a baby, and you may have to subsequently take medications for a long time. Um, a person, sometimes you might be pregnant and may have some type of complication that you may fall in that category as well. Um, so let's look at some of the common medications, or before we get to the medications, diseases that would warrant
Yes.
multiple medications.
Medications.
So,
Yeah.
for example, you've been diagnosed with hypertension,
Uh-huh.
and hypertension itself is, it means elevation, abnormal elevation of the blood pressure. Now, there are several factors that can cause hypertension. You have hypertension type 1 and type 2. Type 1 is generally meaning hypertension that is of an unknown origin. We do not know what is really causing it.
Correct.
It might be genetics, it could be family history, it could be
Or
age,
or
it could
lifestyle
be
related.
lifestyle,
Yeah.
right? And we have type 2, which is generally mean that a medical condition that exists
It's causing.
predisposes you now to hypertension. Okay, so let's say that you are being treated for hypertension. You may be on 2 or 3 or 4 different drugs for hypertension, but each of these drugs, they have a different functionality and they work differently, right? So you may be hypertensive. At the same time, you may have glaucoma and maybe on a medication for glaucoma. You may have high cholesterol
Mhm.
and maybe on a medication for that. You may be diabetic and maybe on a medication for that. And
Or
the
medication or
diabetes,
two.
right? The diabetes may have caused um, peripheral arterial disease where your blood is not circulating very well, particularly in your limbs, and you may have to be on a blood thinner, right? And the list goes on. You may also end up, your doctor may tell you, well, from what we're seeing, you might be having a bit of compromise of your kidneys, right? Because your blood pressure has not been regulated very well, and you're now placed on medicine to help your kidneys. And so, with that type of description, we're seeing the use of multiple medications for that one patient.
And Carlton, in addition to that, yes, and you did mention some of the diseases the person could have complications that also are treated with medications. And then you also mentioned the other situation where someone may have some immune disease. I know some autoimmune disease patients, for instance, lupus patients, that is a chronic example of a patient that would need to take multiple
That's true.
medications to manage this autoimmune condition. And then you also mentioned people maybe with a congenital defect or congenital disorder. And I also know of people just to stay alive, they have a condition, cystic fibrosis, they have something where they need to take multiple medications. So it is a multiplicity of people that this may impact. I definitely don't want listeners to think it's just, because some of the conditions that could be created by lifestyle implications or implicated by lifestyle choices are not the only reasons why people may have to take multiple medications. And sometimes, Carlton, I've heard people or in the medical arena refer to it as drug cocktails when you have to take multiple medications. So, for instance, people managing HIV/AIDS. Before there were combination medications, people would have to take multiple medications. You say you take a drug cocktail. So it's a lot of different people who could be impacted by having to take multiple medications. Yeah.
Now, polypharmacy is one that has come under a lot of scrutiny for prescribers, for pharmacists, for patient adherence and care, and drug management. It has come under a lot of scrutiny because at the end of the day, we have a patient who is prescribed all of this drug. So the doctor could say, or the prescriber could say, well, I've done my job.
Mm-hmm.
I have diagnosed you. This is the prognosis. You can live with this disease. These are the best drugs that I know that can assist you, whether it's to control or to cure or to manage that particular disease, particularly from manifesting major complications. And so I've done my work. Now the onus is on you now, the patient, to adhere or to comply.
Mm-hmm.
Now, it is simple to say that, but what if we as doctors, as pharmacists, were given, for example, a 1 year supply of all of these drugs in a bag and place it on our backs and walk around town?
Mm.
Many of us would recognize how heavy it is.
Quave.
Yeah. So, in a sense, I use that example or analogy to show how psychologically burdensome it can be for the patient
Mm-hmm.
who
Of
has
course.
to adhere to these drugs every day. Whether you feel like it, whether you in the mood, you have to take the drug. So, for example, a critical medical condition like end stage kidney failure,
Mm-hmm.
right? And think of that patient who has to be dialyzed 2 to 3 times a week. Sometimes you don't have the money to pay the bus. Sometimes you're really not feeling like going to the hospital.
Mm-hmm.
But if you miss a day, you are potentially putting yourself at risk to major complications that could cause you to die,
To the air.
right? To die
To die.
prematurely.
Mm-hmm.
And so you're thinking of all of that, and you recognize the psychosocial um, issues that these patients also face on a day-to-day basis.
Mm-hmm.
And so for us as healthcare providers, we have to also take into consideration these factors. So we're going to
Mm-hmm.
look at some of the critical areas of concern where polypharmacy is concerned, the use of multiple drugs.
Mm-hmm.
So, one, we must look at the safety of the drug therapy. How safe is that drug? Now, especially with the elderly, and when we say elderly, the World Health Organization has defined elderly as any person that has surpassed the age of 65. All right? Is considered an elderly or an older person. We normally prefer to use the word now older person,
Older person,
right?
yeah.
So these people, they are more likely to have skeletal muscular problems, arthritis, right? Joint pains, muscle pains. They are more likely to have vision impairment
Mm-hmm.
or some issue with their eye. They are more likely to have nutritional deficiencies.
Mm-hmm.
They are more likely to have um, suppression or um, complications or compromise of a vital organ, right? So whether it's the kidney, the liver, the gut, which are three major areas that drug has to be synthesized or broken down or metabolized. These people are more likely to a lot of these people, some of them are illiterate or not very right, cannot really read and so forth. They are more likely to have cognitive disorders such as dementia, Alzheimer's, so they can remember certain things, right? They are more likely to be living alone because the children have grown. A spouse may have died and they are now alone and they have to manage everything. Okay. Some of them have difficulties with storage of the medicines because not all medicines that are kept at room temperature. So some medicines are also refrigerated and so forth. And we also have to take into consideration the route of administration. So you prescribe a drug that has to be um, injected subcutaneously underneath the skin. How does that person understand what is subcutaneous?
Mm-hmm.
Right? And do they really administer the drug properly?
Mm-hmm.
Who monitors how the drug is administered? The very same thing is applicable to patients who are prescribed insulin on
Right.
a day-to-day basis. And yes, you might take some time in your office as a prescriber and demonstrate how to measure it and how the dosage should be given. But then at the end of the day, who monitors the actual um, practice in terms of the administration of the medicine to know that the patient is actually getting the right dose and is administering the medicine in an effective manner.
Effectively, yeah.
So, when we talk about polypharmacy, all of these must come into consideration. The cost of these medicines, um, explaining to the customer the difference between brand and generic,
Mm-hmm.
right? We also have the situation where patients are more likely, especially patients who have multiple medical conditions, are more likely to shop around looking for doctors.
Mm-hmm.
So they might go to this doctor today, the doctor tell them something, but they have a perception that is not what I wanted to hear.
Mm.
You understand? So sometimes patients go to the doctor with a perception, expecting a particular outcome or feedback. They don't get it. The doctor prescribe XYZ. They come to Jollies, they buy the medicine. Then they go to another doctor. The doctor prescribe another drug. They may not come to Jollies. They may go to another pharmacy.
And by
They
it.
buy it.
No.
We don't know if it's the
Mhm.
same drug. You see where the confusion comes in.
And Carlton, not just that, but the person may visit different doctors because different specialties
That's true.
are, related to whatever it is that's their ailment. So you might have orthopedic issues, you see your orthopedic
Yes.
surgeon. You might have, a hormonal disorder, or you deal with diabetes, for instance, so you see your endocrinologist. You might have some cardiology issues. You visit the cardiologist. So now you have free specialists that have given you prescriptions for different things. And another thing I know that happens too is these prescriptions now may have been given at different time frames. And so the duration of the prescription for each different medication from each different specialist is different, meaning, you started one, it's the prescription is for 6 months, but you started one in May, but the other one you started in the middle of June. So each time the medications are finishing at a different time. That is also a reality.
And I mean, you could not have said it clearer than that in terms of that example, because that's where I was really going into, because it's a big thing, and that is where now all experts need to work together to be able to what we call surveillance, have good surveillance of how these drugs are one dispense. It's fine for one prescriber on behalf of their patient to call another prescriber that the patient may have seen. So even in the dialogue, the prescriber, the doctor should ask questions. Have you seen? Because not everybody, most Dominicans have a medical book, but they may not necessarily go with the medical book to the private doctor at times,
Right.
right? So the private doctor may have some notes, so may have, right? And then so the prescriber at hand should be able to have a rapport, or should be able to call the other doctor and say, well, okay, I have patient so and so with me. They told me that you prescribed some medication to them last week. Is it possible that you can just let me know what was prescribed and maybe what was the diagnosis XYZ? But sometimes that doesn't happen, sad to say. And that in itself complicates the issue of polypharmacy. And then we see now patients are now more at risk to one, side effects, um, drug interactions, drug, what we call drug medical condition interaction, and that's a new term now, where a drug can actually exacerbate or cause a medical condition to
Condition.
occur. So let's say you have rheumatoid arthritis and you have been using prednisolone or prednisone for quite some time. Now we know corticosteroids predisposes you to an elevation in glucose levels, right? So you could end up becoming diabetic. from the use of that corticosteroid.
Mm-hmm.
So we're talking about things like that. Um, and so this is very broad. And I can tell you that maybe if you hear in my voice, I'm very, very passionate about it. Over the past couple of weeks, I've been doing a lot of public health education, particularly to the elder or the older population, on how do we manage this. Even my mother, I recently had to take all my mother's medication and group them and put them at to the specific time of day that she has to take X, Y, Z,
Mm-hmm.
what food that she may have to take this with, which one she needs to take on an empty stomach, all of that, including eye drops.
Mm-hmm.
And what if you have patients who are at home right now listening to us and maybe in the very same situation and have not done. So my mother said to me, she would just take all the medicines at one time. So all what that has to be taken in the morning, put them in her hand and bam in her mouth and swallow.
Mm-hmm.
And I'm like, no, mommy, that can be very dangerous.
Mm-hmm.
So when we're talking about polypharmacy, we must not just focus on the multiplicity of drugs usage, but we must also look at the safety of these drugs,
Right.
the regimen, and we should also too, particularly prescribers, look at the dosage of some of these drugs that are prescribed. I have had, in the 27 years of being a pharmacist, I have had situations where um, I I have had situations where I fell out with doctors,
Mm-hmm.
because when I call you, I'm not calling you to make myself look smarter than you are. Okay, I'm calling you on behalf of the patient because I am looking at the safety of the patient. So if I have a case study in front of me and I see this patient has all of these medical conditions, and I recognize that one of the drugs that you have prescribed may cause major complications, it's my right as a pharmacist to alert you.
Mm-hmm.
You may have a rationale. I may not necessarily agree with your rationale, right? But we're supposed to some way come to a compromise. I must say that most of the doctors that I have interacted with in Dominica have oftentimes comply with my recommendations. But working overseas, I remember there was one particular specialist that believed in oftentimes overdosing. So you have a condition, and it's almost like he was looking for an acute cure right away. So you take the drug, and within 2 days you are much better. But at the end of the day, that dosage can cause other underlying medical conditions. And I
Mm.
would often have a fight with that particular doctor when I lived away. So I know of those situations. And the aim is, how can we reduce the risk to side effects, adverse reactions, drug and food interactions, drug interactions? And how can we ensure that our patients live a healthier quality of life, and not just a healthier quality of life, but a safer quality of
Mm-hmm.
life?
Calda, let me ask you though, if, okay, so there are patients, of course, for chronic conditions, as we've just mentioned earlier, who may be on a multiplicity of drugs, chronic conditions. In addition to having a chronic condition or, a condition you were born with, as we mentioned, congenital, in addition to that, you may then get an acute infection that
Mm,
requires medication as well.
mhm,
So, yes, you already have your medication that you're taking for diabetes, hypertension, high cholesterol, diabetic nerve pain, whatever it is, you're taking this long term, but you get some ear infection, you have strep throat, or you have something that requires some antibiotic medication, or you have something, whatever. you need some antifungal, whatever it is. Does the pharmacist then as well take into consideration when you look on your, can you look on your system and see what are the other things the person is taking in then dispensing this new medication for the acute infectious stage the person is going through?
Good question again. And one of the key situations that comes up to mind is, as you say, a fungal. So somebody, let's say somebody has been diagnosed with tinea veracolea or tinea pedis or tinea capitis, one of those fungal infections. And it is systematic in the sense that it has spread all over the person's body and so forth. And the doctor decide to give an immunozole. So they might give ketoconazole or itraconazole, one of those long-acting antifungal preparations, even fluconazole. Now, that same patient, let's say that patient is diabetic. That patient, and now diabetes predisposes you more to fungal inflammation and the increase of yeast on the skin, especially when the glucose levels are high. You also, to that patient, because they're diabetic, they might be on prophylaxis treatment for high cholesterol because one of their fats may be elevated, whether it's the triglycerides, the LDL, something. And so, because that liver is the drug that actually has to break down most of these drugs,
The
particularly for
liver
the
is the organ,
cholesterol, right?
and the antifungal
Right.
affects it.
Right.
Ah.
So we already have to do liver function tests for these I forget the class of drugs all of a sudden, but for the Lipitor, the Crestor, the
statins,
right,
the statins.
Right.
Okay.
So you already have to do liver function tests periodically, maybe every 4 months or so, to see how the liver is, is getting along, having to break down this drug. And then here it is, you are now have to be given an immunozole that is also a drug that is synthesized or broken down
In the liver.
by the liver. So we see now. So I now have to look at the entire picture and see which of these antifungal agents that might be better to use. So I would maybe recommend in that case griseofulvin, which is an antifungal agent, but it is broken down by the gut versus an immunozole.
That's broken by the
Right?
liver. Okay.
So that's a good question that you raised, and that is why the pharmacist has to be able to know all of those different things so we can intercept and advise the doctor as to what's happening, because that patient may have gone to the skin specialist.
Yeah, of course.
And the skin
Said nothing about
Right.
what are the other
That's
things that
it.
they're dealing with. Yeah.
Right. So that patient may not have said or may not have even worked with any medical history to say, well, I'm taking all of these drugs, and the doctor writes whatever it is. And we also have to look at the dosage and the regimen and all of that, and the length of time is going to be used for. So these are factors that also influences polypharmacy. And again, that's why we as pharmacists, and I keep on saying this over and over and over again to the public, that you need to be more conscientious as to the role of the pharmacist and what may go on behind the scene. So oftentimes people still like to rush the pharmacist. They want to curse, they want to make deba, they want to, and not recognizing that we are really looking at your well-being. And you would be very, very happy to know that we are policing your medical, especially your therapeutic management, your drug management. So that is really, really, really important to us.
Carlton, I wanted to ask now. So in terms, so we're talking, of course, management of polypharmacy, of the patient being on multiple medications, and something comes to mind as it relates to, okay, somebody may be on multiple medications, they've been taking them for a long period or whatever it is. How do you at any period in time understand how this person may possibly be removed from one or some of the medications, or if a reduced dosage is necessary. Is that something that has to, of course, happen in collaboration with the practitioner that prescribed the medication? Is it something that the pharmacist can discuss with the patient as it relates to outcomes from taking that medication, and how maybe the dosage can be tweaked, or medications can be combined or reduced? What is that process like? Somebody's on 10 medications, and maybe, it's been like that for a while, and there is the urge to reduce, or to combine the medical prescriptions.
That's a very, I mean, you're asking me some awesome questions. And you know. Now, one of the key word that you must remember in that, before that decision is made, is
Mm,
risk.
okay.
Risk management. And particularly risk management when it relates to complications.
Mm-hmm.
Complications that may have been developed along the way. So when you go back and you look at the history of this patient over the years, you recognize this was a patient, let us say, that was diagnosed in 2016 with primary hypertension. All right? Hypertension that is of an unknown cause. So let's say it's family history XYZ, right? That patient may also have a history of obesity, right? So we're looking at the nutritional aspect of that, lack of exercise, all of that. Okay. And then along the way, that patient developed diabetes
Mm-hmm.
and circulatory issues. Okay. And so you start seeing newer drugs adding,
Mm-hmm.
right? So that hypertension, because it was uncontrolled, it now precipitated other medical conditions. So before we can talk about um, titration or reduction of medication or omission of medication, we must look at risk management, we must look at adherence or compliance, and we must look at lifestyle modification. What have you done as a patient to compel me that you want to reduce either the dosage or eliminate a drug in your treatment regimen?
Mm-hmm.
And so I have had situations where, yes, we've met people with incredible stories. They got a diagnosis and they didn't just sit down there and say, well, my mother was diabetic, so that's why I get diabetes. Or, well, I come from big bone family and so I am overweight and so there's nothing I can do. You understand? But they got the diagnosis and it motivated them
Mm-hmm.
to do a self audit, a health audit, and recognize, okay, these are the things that I truly need to change, and develop strategies as to how am I going to achieve those goals. And by so doing, being disciplined with it, they
Mm-hmm.
achieved the goals and they made it a lifestyle change.
Mm-hmm.
It wasn't a change just because um, I'm getting married or
Yeah,
because
yeah. Short
I want
term.
to get my green card or that type of thing. It would changes that came with discipline and understanding the medical condition that you have, the complications that you can get from these medical conditions, and what you can do to ensure that your health can be optimized. So before we can talk about that, we must be honest with ourselves and look at these factors. Now, we've seen cases where patients may have been reduced on a drug, and again, it could have been because of a precipitating side effect, adverse effect, or something where it concerns an organ based on blood chemistry that may be noticed to be being compromised. And so the doctor might say, you know what, I'm going to take you off this drug. Okay. However, in lieu of that, this is what I want you to do. How many patients comply with the in lieu of?
Uh-huh.
You understand?
Mm.
So we're looking at that. But that's where the patient education and engagement must be very, very thorough and should not be rushed. So you need to educate the patients on the medications, which includes the purpose of the medicine, the side effects of the medication, the importance of having the medication and taking it. And I remembered I was giving a talk just about 2 weeks ago, and there was a little back and forth with one person who was at that forum. And because she she didn't understand why prevention of complications are so critical.
Mm-hmm. Mm-hmm.
Critical, right? And so the medicines, a lot of these medicines, particularly for chronic conditions, and chronic conditions would be a condition that lasts for 6 and more weeks consistently, then it becomes a chronic and not an acute condition. And so we want to aim for control, control. I'm the vice president of the Dominica Diabetes Association. Dr. Ricketts is part of that association as an advisor. And just, I think, in one of our meetings last week, she was mentioning about a patient who she saw as a high schooler. I
Mm-hmm.
think it may have been as at a high schooler she saw, and recognized that this patient was developing glaucoma.
Mm.
But that patient was coming, the mother was making sure that, she adhered to her appointments and was coming in all the time. When that person became an adult, the person stopped going to see the doctor.
Mm-hmm.
And when she did came back, it was like 6 years span. And she was right on the verge of getting blind. She eventually became blind. You understand? So if she was adhering to her visits, her use of eye drops and so forth,
Mm-hmm.
she could have been still been
Mm-hmm,
here.
mm-hmm. And the doctors will always tell you that is the purpose of the management of the chronic disease, to avoid the complications which are then more difficult to deal with.
That's it.
So yeah, so I was having a discussion with my doctor recently, and she said to me, sometimes people don't want to take or adhere to their medical regimens for hypertension, for instance, but the purpose of it is to avoid the stroke, the heart attacks, that are so common. That is what. So if of course the blood pressure is uncontrolled, then you are at high risk for a stroke, for a heart attack, which of course is then either will cause death or will cause you to be in a state that is even more difficult to manage, as a survivor of a stroke or survivor of a heart attack. There are even more things that you have to take into consideration. So yes, the management of the possible complications of the chronic disease are the true goal of the medical, whatever is the medical regimen that you are on, the avoidance of the complications, I would say, of the chronic disease.
One of the major problems that we've seen and we continue to see, is the tracking of these medicines. And that is why I have made that as one of my services. And I've asked, people that are on multiple medicines to bring those medicines across to our pharmacies, and our pharmacists will be able to help to sort them out for you. Because that's really important. Some people do get medicines from the primary healthcare system. Some people buy from pharmacies. Some people get different brand names from generic names, and they end up having a lot of confusion. So you may have somebody having glucophage brand, metformin brand, and it's the same active ingredients. They don't know. And so that patient might be taking the two drugs at the same time, and could cause hypoglycemia, or a massive reduction in your sugar level, which could send you in a coma. So these are things that you want to be cognizant of, you want to be aware of. Um, Doctors as well, finding out what combinations that are available. So some drugs you can get combinations in them, two drugs or three drugs together, and so that reduces the quantity in terms of the number of different medicines that a patient has to take. So that is something to that the prescriber should be aware of, looking at the different options that are available. But I know sometimes with the options that are available, cost
Is a
also
factor,
come
yeah.
as a factor. And
Mm-hmm.
we know that with the rising inflation and so forth, it's making it more difficult for people to buy particularly first line brands of drugs. And that becomes a major issue. So a patient may buy this month and then next month they broke, they cannot buy, they alter the medicine, they cannot get it from the hospital service, maybe because they've been seeing a private doctor, that type of thing. And so these are some of the issues that we have. Like in Barbados, even if you were to see a private doctor, you can still use that prescription and access the primary healthcare system and get the
Mm-hmm. And
drug
get
there.
the drug.
But that's their system. Our
Mm.
system is different. I see
Mhm.
we had a caller a while
Yes,
ago.
Yeah, and Carlton, let's open the lines. I know maybe some people have had some questions as it relates to our discussion. 4493095, 4493096, 4493097, or 6164257. We do have a caller on the line. Let's take this call.
Good morning to you, caller. Thanks for calling.
Good morning, Tuti.
Good
Good
morning.
morning.
Good morning, Carlton. How
Good-
you all doing?
We're
We're
doing quite
good.
well. Good morning.
Carlton, I just called to tell you thank you for a very educational program this morning.
Thank you.
Because you said something that I didn't know about. When people say high pressure, but there's only one type of pressure. I know that's stage 1 and stage 2 diabetes.
Mhm.
But I didn't know this. When you describe the type of pressure that one can have and the type, I said, what? I thought it was only, you have pressure, you have pressure.
Mhm.
Yes.
Thank you for really educating the public today on that subject you have there, Carlton. And you're not too old, you're not to go and get your white coat. How long that's taking you for to be a general practitioner?
Maybe it took me about 5 years.
But you still be 55 and you'll pass at the flying colors. Have a blessed day.
Thank you
Bye
very
bye.
much. Thank
And
you.
just nice seeing you and your family.
Yes, my dear. I appreciate that. You too.
Bye bye.
Yes. Yes.
Thank you.
All right. So the numbers
Yes.
are 4493095, 4493096, 4493097. Let's take this caller. Good morning to you, caller. Thanks for calling.
Yes, Mr. Lando, good morning.
Good morning to you, sir. How are you today?
You're taking it easy, brother.
Awesome.
Good morning to you.
Excuse me?
Listening to the conversation,
Mhm.
I always listen to people to lives on Friday every week. But if you have pressure and you are diabetic, you take your pressure tablet, and how minutes after you're going to take your sugar tablet.
Mhm.
Okay.
If you take there's a small one and the metformin, how many minutes after your pressure tablet is going to apply?
Do you know the name of the blood pressure medicine that you're taking?
Excuse me?
Do you know the name of the blood pressure medicine that you're taking?
I don't know that yet.
Okay. All right. Okay, that's the
Um,
question?
Yes, that's the question.
Okay.
Yeah.
Mr. Lando, all over, right? When I can see you that we keep our conversation, because I work in tonight and I'll be off tomorrow. I have to come and get my medication tomorrow because my medication finished.
Well, we can see tomorrow morning. That should be tomorrow. No, tomorrow morning. No, not it can't be tomorrow. My day's booked already for tomorrow. It would have to be most likely Friday morning.
I know I'll be working Friday morning.
Yeah. So Sunday next week. It will have to be Sunday next week. I have to look at my calendar so I can tell you exactly what day yet.
Okay.
Okay. Sorry about that. No, but that's a good question that you've asked. Again, too, it comes with the different
Time
classes.
in, yeah.
It comes with a class of medicine. So if you're using an AC inhibitor and nalopril, captopril, these types of drugs, they are supposed to be taken on an empty stomach. So we normally recommend that they're taken on awakening in the morning. Okay, if you're using a calcium channel blocker like nifedipine, these are again, best taken on an empty stomach. All right. So again, I cannot generalize because I would have to know what drug you're taking, what class of drug that you're using, so that I can tell you the better time or the best time of the day to take it. Okay.
Mhm.
Um,
We
we have another
Yes, we
caller.
have another caller. Caller, good morning.
Good morning, caller.
I wanted to ask you that question and that just slipped my mind. Can someone take like quinol, CoQ10, and vitamin D3 together?
CoQ10 and D3 together. Um,
And
yes.
CoQ10 is more or less for your heart.
Yes, but CoQ10 also has blood thinning properties.
Okay.
Yes, but
That's
it
what,
can be taken with vitamins D3. Yes,
but not the vitamin.
but and it can be taken with vitamins K as well. Okay, can be,
Okay, thank you.
yes, yes. Okay.
Yeah. And thank you, caller. And Carlton, you see, that's another aspect of the conversation. I remember once I was taking some medication, which also included my supplements that I would take. You know, I take vitamins at the time I was taking turmeric capsules or whatever. And somebody said all of those things. So as you know, the caller mentioned, you know, the vitamin D3 and you know the CoQ10. Sometimes, in addition to some of the prescribed medications, people may also be taking certain supplements as well. And so all of these two need to be considered when taking the medication, if there might be any interactions, if there might be any, you know, risk factors of combining certain things. And I think the conversation is therefore so necessary with the pharmacist and the patient when deciding to take certain things.
Awesome, and that's true, and that's why we've always said to, um, a family member sends some supplement for you. A gentleman came to see me, a lady came to see me last week over something like that. So somebody, children sent her something, and she wanted some advice before she used it, and that's the type of advice we want to give to you. That you get the credible fact first before you use the product, whether it's a supplement, whether it is some type of a rub or whatever it is, because it is still going to be absorbed in the body and can alter the normal functioning of the body and even key organs. I see we have another caller. Let's take this caller, please. Good morning to you, caller. Thanks for calling.
Morning, Carlton Monson. How are
Good
you?
morning. We're doing quite well.
Carlton, I just want to ask a question. Centrum Silver, you can take that anytime or what?
I would recommend Centrum Silver to be taken after breakfast in the morning. You don't want to take it late in the afternoon, in the evening, as it may optimize your energy levels and make you a bit restless in the evening and cannot really sleep. So in the day when you need that energy, that's the best time to take it. So
After breakfast?
after breakfast in the morning, you take
Okay.
it with a full glass of water or some juice, but you do not take it with tea. Don't
Okay.
take it with tea or hot tea or something.
All right.
anything like
I
that.
want to make another request from
Mhm.
you. Because at some point in time, I don't know, can you all have a program on bullying? Because to me, I find bullying have some health problems.
Yeah, it does. It does from a psychosocial standpoint.
Yeah, somebody can take their life for bullying.
Yeah.
And,
We'll bring a psychologist on to focus on that.
Thank
Maybe
you very much.
yeah.
Okay,
And
bye.
maybe it would be good to bring maybe a school counselor, somebody that deals directly with that type of issue every day. On. So yes, we will definitely consider that. But truly, I wanted to also mention to um some other areas too that are very, very important. Um, as we're talking about the monitoring process, medication reconciliation. So it is important that you go. That's why we're talking about the pharmacy. So your healthcare provider go through the medicines and look and see. When I worked in primary healthcare system many years ago at Roselle Center, that was one of the things that was a protocol when a patient would be coming for medicines to replenish their stock. They would have to walk with their old bags, the old bags that they would have had. So it was a way of surveying whether they had medicines at home hoarding, or whether they were taking the medicine. But I think some people outsmart us, yeah? And some of people maybe have put them in other things,
Mm,
but that happens. But that is still very, very important to monitor the surveillance of these medicines, particularly as it relates to controlled drugs. I've given you, 30 concerta pills, and by the 15th day, you're telling me that you lost the concerta, and if you can get another supply. No, we don't. We cannot help you with that. So things like that, and people find all types of ways to mama guy and to try to see if they can skim the system. But in my years of doing this, you can fool me.
mm,
I can read right through those things. So this is very important. Um, the use of tablet organizers,
mhm,
that is important too, where you can have your days Monday, Tuesday, Wednesday, Thursday, Friday. Having a chat, as we said, putting a chat there. Having an alarm on your phone, so you could know, well, okay, this is the time to take my eye drop, this is the time to take XYZ. You can even have different types of alarm for different situations, so you know the differences of the alarms.
mhm,
No, particularly when it comes to eye drops, they should be spaced. So you might be using three different eye drops at evenings, but they have to be spaced. All three should not be used bam, 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 bam. And the eye specialist would normally tell you that. And we would normally advise you, depending on the type of eye drop that you would be using, because most of the times, because the mucosa lining of the eye is so viscous, it absorbs very, very, very quickly. Some of these eye drops can cause a little irritation. Some of them can cause a reduction in your blood pressure, particularly if you're using the beta blockers, eye drops that like Timonol and so forth, that helps with glaucoma. They can drop your blood pressure very quickly. So you want to be aware of that. So we always advise people to space their eye drops. And if you are using multiple eye drops, to ask the pharmacist what is the best time to use these eye drops.
mm.
Okay.
And cousin, I wanted to, there is something that I feel very strongly about when it comes to treatment or health. I often say, the individual is the CEO of their health.
Uh-huh.
The person and their preference, their lifestyle, or their schedule often has to be, or not often, needs to be taken into consideration when you determine treatment. So it's the same for prescription of medication. There are some people, for instance, based on their schedule, they're very busy, or they work at certain times, and so taking medication at certain times might not be optimal, or medications that maybe have to be very frequently taken might not be optimal. There might be another route, another way that you can maybe take something that is maybe something that is long acting, and you don't have to take it so frequently. So the conversation also with the pharmacist or with the prescriber of the drug has to entail lifestyle and preference. And I am a person that always advocates for that, and I want to know your take on that as well, because I clearly tell my physician, this is what I do, this is what I don't do. So something has to be, for me to adhere, it needs to fall in line with my pattern. Otherwise, it's not going to work. you know. So I want
Great
to know
question.
your take on that,
All right.
Carlton.
Before I answer you, I want to let's just take the callers
Mhm.
quickly. We don't want to keep them waiting, and then I will answer you. Good morning to you, caller. Thanks for calling.
Hello,
Yes, good morning to you, caller. Good morning.
that's Jolly's Pharmacy Show.
Yes, yes, ma'am. Yes. Just look.
Carlton,
Yeah, yes, it
Yeah,
is.
listen.
Just listen to us. Speak into the phone. Don't listen to yourself,
Just listening to the radio.
because you'll get a delay.
I
So
just, I
turn
just,
off
I
the.
just,
Uh-huh.
I just want to ask a question because I realized that you've been talking about the best way and time to take your drugs. But I'm saying that when the doctors, write up your prescription, you get the drugs from the pharmacies, and they say take with food and or not take. Okay, take with food. So you must take that particular drug with food. But any other drug doesn't say take with food or whatever. So you can estimate your own timing that you will take that particular drug.
Okay, so you want me to comment on that? Okay, I'll comment on that. I'll comment on that. Yes,
Let's take
let's
this
just take
other
the other one
call.
quickly. Yes, thank you for calling. Good morning, caller.
Hey, good morning, Calvin. How are you doing?
I'm doing well.
Judy, good morning to you.
Morning.
Okay, Calvin, you passed on so many things, but something like this I picked out of your contribution.
Mervyn, I'm not hearing you clearly. I don't know for whatever. I'm hearing a little like a muffle. So I know you should. I'm hearing you much clearer now. Yes.
Okay, all right. I was saying, you touch on ACE inhibitors in your conversation.
Mm-hmm.
There are a lot of people on ACE inhibitors for prolonged periods. Is that healthy or detrimental? Because I'm reading up on these things and I'm researching these things, and a lot of people are on them for prolonged periods. What is your views on the prolonged use of ACE inhibitors?
Okay, I'll answer you.
Yeah, thank you.
Thank you.
So I'm going to start with Trudy first.
Mhm.
And that was such an important part of the discussion.
Mhm.
Looking at the flexibility or inflexibility
Inflexibility of
right,
the patient.
of the patient. That's
Mhm,
important.
mhm.
Because I worked in Portsmouth last week, and there was a grown lady who was given medicines, 3 different medicines. And believe it or not, I had to compound all the medicines into liquids for her.
She
Because
cannot
just
swallow
cannot-
pills.
Right.
Ah, boy.
Right? And she told me she don't care how much it cost her.
Mhm.
Right? So she had to come back because we had to do the calculations and formulate it into liquids
Mhm,
for.
mhm.
So that is important. You want adherence, the form of the treatment that is more comfortable. You spoke about long-acting medication, prolonged action medicines, sustained release medicines, and their importance. That actually helps a lot. So in the interaction with the patient, and that's why I don't think patient-doctor visit should be rushed.
Yeah.
In the interaction, all of these should be part and parcel in determining what should be prescribed, the different routes that might be available. Some persons have absolutely no problem using insulin. They prefer to use insulin every day than take a pill or take multiple pills every day. You understand? So it's what is best or what is more flexible. But again, we must factorize cost.
Cost, yes.
Yeah,
Yes,
must come in.
cost comes in, but sometimes some people would prefer take the high cost and get the route that is they're most comfortable with. A little interesting one I want to insert there. Some people, for instance, just cannot think of taking a pessary whether it's a vaginal or anal,
Yes.
pessary,
Yes,
insert suppository, so that just
It quivers them.
right.
Yeah.
So you have to have that discussion with the patient so that the adherence is optimized, because if the person is not going to take the thing because it doesn't fit in either with their schedule or with their preference, as you mentioned, the lady who couldn't swallow pills, then you're not going to have an effective
But
outcome.
that's where also to the education is important, because
Mhm.
let us say that a patient has peptic ulcer
Mhm.
and you want to give a non-steroidal anti-inflammatory drug like diclofenac also, then the suppositories would be the
Would be
preferred
the
choice.
best. Okay.
If not, then they would have to take an injection, right? Or maybe a patch or a rub. But again, it depends on the severity of the pain.
Okay.
And then, but you also want to look at what exactly is the benefit of that drug. Do you want an anti-inflammatory benefit, or are you just looking for an analgesic, something just for pain? So if you're looking for something just for pain, and then you can just give maybe pethidine or so because it's not anti-inflammatory. So it's a lot of variables.
Yeah, a lot of
that
things to
comes,
consider. Yeah.
that comes.
Mm-hmm.
Now, the patient talk about drugs and food. Now, every pharmacy should have what we call auxiliary labels.
Mm-hmm.
And auxiliary labels are the little stickers that we stick on your medicine to give you further information as to what is best practices, what you can do, what you can't do whilst you're taking these or this particular medicine. So when you go to the pharmacy, you can ask for auxiliary labels. We normally say that if you're told take with food, it means that you take between whilst you're eating, you stop, you take the pill, then you continue eating. That's eating. That's taken with food. Take after food, after you've eaten, you take the pill. Take before, we normally would give you a time frame. Some drugs 30 minutes before, some drugs an hour before, some drugs 2 hours before. So based on because some drugs, when we talk about on empty stomach, it means that food tend to delay the absorption of the drug and affects the how quickly the drug is going to reach its peak in the bloodstream. So these are some of the things that we would talk about when it comes to drugs and food. In reference to the AC inhibitors, AC inhibitors in some cases, especially in men, we've seen that they can cause a bit of erectile dysfunction. That is something that if you are on an AC inhibitor and you notice that, but we still have to evaluate: is it the AC
Is that the
inhibitor
cause?
that
Mhm.
causing the erectile dysfunction, or are there another
Other.
factor, other factors? So we
Mhm.
cannot, but we know from a clinical drug standpoint that some AC inhibitors can cause erectile dysfunction, particularly on the dosage. Persistent cough, dry cough. Some AC inhibitors have been culprits to that. Most AC inhibitors can cause that, a dry, persistent cough. If that occurs, your doctor will immediately remove you from the AC inhibitor. Generally, they are very essential. We still use them a lot in drug therapy. But again, it's looking at the side effects. If you're experiencing a side effect, to let your prescriber know. If you're not experiencing a side effect, then it is fine.
Mhm. Okay.
It is fine. Okay.
Okay.
It is 11:45.
Yes,
It's a topic that I'm very passionate about, as you would notice, and the more that I do research on it, is the more that I'm recognizing how comprehensive it is, and how if we don't have these dialogues, how we might be shooting ourselves in our foot. So here it is: we might be thinking that we're doing the right things, but we might actually be creating bigger problems
Mhm.
if we don't um, do the monitoring, the management, and the surveillance.
Mhm. Mhm.
It is now 11:35. We are just about out of time of Health Vibes this morning. It was a pleasure bringing this episode to you. I know soon we will be doing a show very, very soon. It will be somewhere this month with a visiting urologist.
Mhm.
We will be broadening the discussion. So all questions that you have relating to bladder issues, relating to the male reproductive system, um, he will be able to answer that. It's a urologist from Antigua, so we'll be connecting with him very, very soon. Sometime this month, we will be having a show on breast cancer. As you
Mhm.
know,
This
it's
is
breast
October, is
cancer
Breast Cancer
awareness
Awareness
month,
Month.
and so we will be discussing breast cancer subsequently. And in November, it will be diabetes awareness month, and we will be having. I know Dr. Ricketts will be on somewhere in November on that show, and so we are planning some really good shows for
Mhm.
you as we are winding down 2024. So,
Mhm.
as always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and continue to have an awesome week. Bye bye.
Goodbye.
Johnny's Pharmacy, brand new website. www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features